This abstract is meant to highlight a difficult situation we have where we have the equipment, the resources, the manpower, the center to do certain types of surgeries, but because of problems of affordability, a lot of children are not able to come to surgery, even though they have diagnosis. It's said that approximately 90% of more than 1 million children who are born with congenital heart disease around the world would receive suboptimal care or no access to care at all. And about 50% of these children will die during their first 5 years of life before they receive any proper treatment. In Ghana, we have not accurately assessed the magnitude of this problem. Next slide. Now, what we did was a retrospective search of the echocardiogram database from January 2006 to December 2010. We used 15 years as the age cutoff for all patients who were diagnosed for the first time with a congenital heart disease. Next slide. Now, first-time diagnosis, there were 4,823 new echocardiograms, of which 4,396 were first-time diagnosed with congenital heart disease in the echocardiogram database. Of these, we were able to enroll 60.3%, and the ratios was about equal. Male to female ratio was about 1:1. Next slide. Now, we found an interesting distribution of age at diagnosis. Only less than 10% of all congenital heart diseases in Accra, less than 10% are diagnosed below the age of 1 year. That means only 10% of congenital heart diseases were diagnosed in the infant period, less than 1 year. Now, the other third are diagnosed from 1 to 2 years. So 1 to 11 months, a third of them are diagnosed. Then 1 to 4 years, another third. And then 5 to 14 years, about another third. So we have this trimodal distribution. That means 90% of all our diagnoses are beyond the age of 1 year. Obviously, if you have a critical congenital heart disease, then you are in trouble. Now, we also found an increasing trend in the number of new cases of congenital heart diseases that were coming to echocardiogram, from 318 in 2006 to 758 in 2010. Next slide. And this is the distribution. Among the acyanotic group, the VSD is the highest, about 41%. So roughly 40% of all the acyanotic congenital heart diseases we see are VSDs. Next slide. And then the cyanotic congenital heart disease, most of the others happen to be in the critical congenital heart setting. So tetralogy of Fallot dominates. About 3/4 of all the cyanotic ones are tetralogy of Fallot. The others, I'm sure they will be long dead by then. So for the 5 commonest congenital heart diseases in Accra, this is our distribution by the pie chart. VSD is taking a huge chunk. Next slide. Now, we look at the rate at which we are operating on them. This is ASDs. In 2006, there were 52, and then we operated on 7. By 2010, we were diagnosing about 97 ASDs. In a year, we operated on only 14. So in terms of absolute numbers, it appeared as if we are operating on more patients, but in terms of the fractional operation, we're about the same. The highest fraction that attained surgery was 21% in 2007. When we go to VSDs, in 2006, we saw 89 VSDs for the first time in the whole year. By 2010, we're seeing 239 VSDs for the whole year. We operated on 17, and then we increased to 24. But in terms of fraction, we're doing better, 19.1%, but we're doing only 10% over here. The same with the other diagnosis, the PDAs and the tetralogies. I selected these ones because these are cases for whom service is available, good quality service is available. And we have so many, but we operate on so few. Next slide, please. And so on the average, if you look at the number of congenital diseases we see in a year, less than 15 years, it stayed about the same. We are doing just about 1/5 of the ones that we diagnose. Just about 20% of all congenital heart diseases that are diagnosed get treatment. Next slide, please. And so when one takes a look at the absolute figures, you are deceived by the fact that we are doing more. But what we are doing is actually not catching up with the population. So in terms of the fraction of cases diagnosed that are having treatment, we are actually going down. Next slide. Now, the vision for the World Society for Pediatric and Congenital Heart Disease, or surgery, is that every child born anywhere in the world with a congenital heart disease should have access to appropriate medical and surgical care, and children in Ghana or Africa should not be any exception to this. Next slide. Now, the global incidence has been discussed extensively among the other speakers, and for Ghana, Dr. Edwin has spoken about average annual rate of about 5,800. Next slide. No. Next. Now, the problem here, obviously, is our inability to comprehensively treat all the congenital heart diseases we diagnose. Everybody contributes a little bit of money set aside so that if you should develop some kind of heart disease in future, if you should give birth to a child who has a heart disease, then you can have access to care. This has been practiced in India, where they have large populations and people can contribute as little as $5 and to be able to afford open heart surgery. Then private individuals need to come in. Those who have so much money, having big private parties in Dubai and riding around in jets, if we're able to talk to them to commit a little bit more of their funding and bring down the price. Currently, the price is anywhere between $5,000 and $6,000. If we can get a little more money and bring down the price to the family to about $2,000, then we can increase it by 7-fold, and hopefully we'll be able to treat everybody that we see. Next slide. Thank you very much for attention.